For those women that want to go for epidural injection, that is the pregnant women now that want to go for epidural injection. Epidural injection is just an injection that is put in the back for women in labor so that the labor will be painless, right? It will be painless. You will not feel pain during the labor. And even when the epidural is on, you will still be able to move around. So that story of once they put epidural, that the woman will be paralyzed, the woman will not be able to move around. Even after the woman have delivered, the woman will be paralyzed is a lie. With epidural injection, the woman, ask some people, ask some women are watching this video that have done epidural, right? Ask them whether they were paralyzed after the epidural. They will tell you that they were not paralyzed. Even after the epidural has been placed, they were still able to move around. They were still moving around. So the issue of epidural causes paralysis is not true. It will not paralyze you, even during the labor and after the labor. So you are not going to get paralyzed because you did epidural. And I have asked some women that have, in fact, I've seen it. I've seen it. We've administered epidural before in labor ward, and I've seen it being done, and we have never had any complication. The only thing I notice women have with it, the only problem I notice women have with it is that it's expensive. Then, when I was still, we were still administering epidural. Well, even up till now, it was around 150. No, okay, it was 50,000 because it was in a teaching hospital. Now I heard it's about 100,000. I know some private centers put epidural, do epidural for like 300,000, 150,000. Some I even heard some 500,000, depending on the center you are doing it. But if you are doing it in a teaching hospital, in a government hospital, right, it is very affordable. You can do it. But back to the topic, epidural will not paralyze you. So all those stories you are hearing here and there that epidural will make you paralyzed. See, you must not feel pain during labor. Life has science have made things, have tried as much as possible to make things very easy. So you must not feel pain during labor. It's not a must that you must feel pain. All those I want to feel the pains of labor that you people always, I don't want to use brag of. It's not a must that you must feel that pain. And there are some women that don't want to feel that pain. If you want to feel that pain, okay. But if you see a woman that wants to do epidural, don't try to discourage her. You want to feel the pain. She does not want to feel the pain. It's a matter of choice, right? So epidural does not, and because you don't like epidural, you start bad mouthing it. You now start saying things that are not true. That I know somebody. You're always knowing somebody. You know somebody that knows somebody that did it and there was paralysis. The answer is, the truth of this whole issue is that epidural does not cause paralysis. Epidural is done by trained anesthetists. A trained anesthetist, an anesthetist is a doctor, right? It's done by a trained anesthetist, and the patient will be monitored throughout the course of labor, but the patient will not have pain. That shouting in labor and the rest will not be there, and the patient will have very stress-free labor. So if you want to do epidural, why not consider it? So all those stories of the woman will be paralyzed, the woman will, there's another story of the woman will have this back pain that is refusing to go. The pain is always there. Don't you think sometimes this thing is psychological? You just feel because they put needle in your back to give you injection in your back so that you can deliver safely, you just feel that pain is now there. You should consider all these things and look at it critically. The life is changing. As time goes by, all women in the world, in fact, in the next 10 years, most labor ward will start, they will tell you epidural. But as at now, it's you that will say you need epidural. But in the next 10, 20 years, epidural will become compulsory for all women in labor, because the aim of medicine is to kill pain. It's not is becoming something like archaic to see women shout in labor, shout because they want to give birth. And some of you have given birth before. You know how painful it can be. I'm a man. I can't really. I'm trying to put myself in your shoe, but I cannot really understand how much pain it is. But I know that you are in severe pain during labor. So with time, government will come up with a policy that all women that are going to labor should get epidural. So what are you now going to do then? You will reject. Okay, you will still have choice, yeah, but the story of epidural causing paralysis, remove it from your mind. Thank you and bye bye. Before I go, I have a YouTube channel. The name of my YouTube channel is Nigerian Health TV. Right? Nigerian Health TV. Don't forget to subscribe. You can use the link in my bio. Right? The name of the YouTube channel name is Nigerian Health TV. It's right on your screen. Bye bye. But remember, epidural does not cause the kind of paralysis you are saying it causes. Allow women that want to do epidural have it in peace. Bye bye.